Hey, Dr. Elliot Hirschhorn here with New Life, and I wanted to talk to you a little bit today about ways that you can support your immune system. And specifically, I want to talk about this in reference to a virus that's been going around the world in 2020. I'm not going to name it. You all know what it is. I don't want to get put in social media jail by posting some information. So we'll just go with the fact that we all know there's a virus going around, and we know a lot of information scientifically, medically about viruses and how they work in general. And so we're going to talk a little bit about generalities in regards to how we know viruses operate and things that can help your body to fight off viruses. But there's some research that was published earlier in 2020 about an antioxidant called glutathione and how it the deficiency of glutathione has been associated with more severe manifestations of the disease that's caused by this virus that's going around here in 2020. So if this is actually the case and glutathione is deficient, creating more symptoms, then a simple fix you would think would be to make sure your glutathione levels are adequate. And so that if you come in contact with the virus and your body's fighting it off, you have a better chance of having fewer symptoms, more moderate or minimal symptoms, or maybe no symptoms at all. It's a possibility. So let's talk a little bit about, kind of back up and give you a little bit of background about glutathione and what it's doing in the body. So glutathione is your master antioxidant. So anti meaning against, oxidant meaning oxidation. Oxidation is really a process that results from having reactive oxygen species. And reactive oxygen species are produced normally by the body as a byproduct of normal cellular metabolism. And these reactive oxygen species, if they don't get recycled, so to speak, and have their toxic effects turned off, they can be associated with long-term cellular damage, which then turns into chronic disease as well. So increased reactive oxygen species or decreased antioxidant activity has been linked to diseases like cardiovascular disease, pulmonary diseases, diabetes. All of these things that we know already increase your likelihood to have more severe complications with this virus in 2020. So glutathione is, as I mentioned, your master antioxidant. So it's the main thing in your body, in addition to others like superoxide dismutase. But glutathione is the main one that helps to convert these reactive oxygen species into more inert or harmless compounds that don't cause damage. And so if you don't have enough glutathione, then you're going to end up with these excess reactive oxygen species. And so when we look at glutathione in particular, it's involved in things like detoxification, regeneration of vitamins like vitamin C and vitamin E, which are also antioxidants in their own right. Maintenance of mitochondrial function. Mitochondria is your powerhouse of the cell. Antiviral defense is also important function of glutathione, is also in addition to just general immune response. And so they go along in this article and they talk more about, and this is available in the Infectious Diseases Journal. It was published, I believe, in May. But they go on to talk about glutathione deficiency and how it potentially can contribute to the worsening of the symptoms associated with the virus in 2020. So one of the categories of increased severity of symptoms related to the virus is being older, so age 65 and above. And your levels of glutathione as you get older progressively decline. We already know this. And then also the less protein you take in, because glutathione's made up of amino acids, which is what makes up protein. So the less protein you take in, or less protein you're able to absorb and digest, the more likely you are to have lower glutathione levels. So as you get older, your glutathione goes down, and then if as you get older you're just eating less protein or not absorbing it as well, that could also decrease your glutathione levels. Second big category of causes for low glutathione would be low glutathione intake, aside from protein, but also fruits and vegetables. So fresh fruits and vegetables are a natural source of glutathione. And so if you're not eating a healthy diet full of fruits and vegetables, which are really important for a whole bunch of other reasons aside from glutathione, but this is one specifically, then you're going to see a decrease in glutathione levels. Being male is just a risk factor also for having low glutathione levels. Cigarette smoking depletes your glutathione levels as well, because cigarette smoking creates more of those reactive oxygen species more than you produce naturally. And so it eats up all your glutathione, essentially decreasing those levels available to help you with other things. And you see in the background here, I've got some Pac-Man illustrations on my screen, and that's really the way you can kind of think of glutathione. So glutathione kind of eats up all of the reactive oxygen species, but then you've got those bad guys that go around and inhibit glutathione, Pac-Man's ability to eat up the other things, reactive oxygen species. And so those are the things that we're talking about now. The bad guys in Pac-Man are things that affect glutathione levels, so age, being male, not eating fresh fruits and vegetables, cigarette smoking, and then just chronic diseases in general. Deficiency in glutathione is a common finding in people that have chronic diseases like type 2 diabetes, obesity, cardiovascular disease, liver disease, cancer, etc. And whether or not that's the cause or the effect of those chronic diseases, I think, is yet to be fully determined, but it is an association. And so if you have those chronic diseases, you have low glutathione, and we already know that those chronic diseases are associated with increased risk for complications with the virus from 2020. There's also another question about glutathione and its relationship with vitamin D. Vitamin D being low has also been associated with more severe complications with the virus. And what they're discussing in this research is that low vitamin D is actually associated with low glutathione. So is your ability to have and maintain a healthy level of vitamin D dependent on having a healthy level of glutathione? And what they're arguing is that if your glutathione is low, that you're not going to be able to maintain a high enough level of vitamin D, and so that it's not necessarily that the vitamin D is the root cause of more severe complications with the virus, but it's actually glutathione being low, which causes low vitamin D, and both of those are associated with the more severe complications with the disease. A couple other things to highlight with regards to glutathione and its effects. It does have antiviral properties in general. It prevents having a higher viral load. It also helps to prevent the release of the inflammatory cytokines into the lungs, for example. And that was one of the big things you heard on the news earlier in the year when they were talking about the cytokine storms. And those, you don't hear it anymore for whatever reason, but that's still going on. And glutathione helps to prevent that spillover of those cytokines and the release of that. Some previous studies on glutathione and its precursors like N-acetylcysteine or NAC also show that reduced incidences of other viral-based diseases when you have supplementation of NAC or glutathione, especially in people who are at a higher risk, like the elderly. So when we look at, what can we do to help support our immune system, support our bodies so that we can fight off whatever we're exposed to, whether it's the virus of 2020 or the common cold virus, which is very related to the virus of 2020, or any other virus there for that matter. There's a lot of things you can do to help support your immune system. And actually glutathione is one that we've used at New Life for years to help support the immune system with autoimmune patients, for example. But you want to be able to supplement with glutathione to get your levels up to a high enough amount so that you are prepared, so that when you are attacked by a virus or bacteria, whatever the case may be, you have the excess glutathione to help sort through that process, reduce the oxidation, and have an opportunity to fight it off without being overwhelmed with the severe consequences. So everything we're talking about today in this video is not approved by the FDA to diagnose, treat, cure, or prevent any disease. That's not what we're talking about. We're just talking about physiology and what we know about the human body, what we know about the interaction between the human body and pathogens, viruses in particular. It's all based on what we see in the data and the research. But we're not saying that glutathione or anything else is a cure or a prevention. Those are things that have to be approved by the FDA, and that's not what we're talking about. What we're talking about is how can you augment or improve, support your immune system as best you can. And we always say that using food as medicine is your priority. So eating fruits and vegetables, eating adequate amount of protein, making sure that your gut can digest and absorb those things is really important. But then you also want to make sure that you supplement on top of that, because that can only go so far. So you want to find a good quality glutathione supplement, or N-acetylcysteine, which is a precursor to glutathione, NAC supplement, to help do that. And we've made it simple by doing a lot of the research and combing through the different options that are out there. And what we use, and I use this myself, I just took it, is a product by Apex Energetics called Trizomal Glutathione. They really have created the best product in a number of ways. Number one, it's in a liposomal form, so it's highly bioavailable or absorbable through the gastrointestinal tract. That was one of the problems with a lot of glutathione supplements a couple of years ago and prior, is that you could take the glutathione, but it would get eaten up in the digestive tract. It would never get absorbed in the bloodstream. So they've created it in a bioavailable delivery form through this liposome. And there's some other liposomals out there as well, but they all have the really bad sulfur taste. This one actually tastes pretty good. Not everybody loves it, but it's tolerable. I think it's fine, but it's the best tasting comparatively glutathione, liposomal liquid glutathione product that's out there. The other thing is that it's got multiple different types of glutathione in there. It's got the reduced glutathione, which is really the active form. And then it has a couple of other forms in there, like the N-acetylcysteine, which is the precursor to glutathione. So it's got all the different components of glutathione precursors and the forms that are easily used by your system. So we've had patients on this glutathione that have seen dramatic improvements in various different symptoms for various reasons. And when they go off of it, their symptoms return. And I'm not going to get into all that. Again, we're not diagnosing, treating, curing, or preventing anything with glutathione. We're just supporting the body's ability to regulate itself, which it has the ability to do. So if you want to set yourself up for success this winter with the common cold or the virus of 2020 or anything else, you really should look into getting some glutathione, whether from us or from wherever. We believe that the Apex product is the best one that's on the market that we've used. It comes, unfortunately, it is liquid, so the bottle form has to be refrigerated. There are individual packets that are easy for travel or going to and from the work, that type of thing, that don't need to be refrigerated. So there's a couple options there. In any case, I hope this has been beneficial for you. Our goal is to educate our patients or people who maybe not our patients. Just educate the public about health and wellness and how you can do things in your own life, take control of your health, so that you can get back to living your life or maintain the health that you've already established for yourself. And glutathione is one of those things that, in my opinion, everybody should be on, whether you have an illness or not. It's going to help you to be set up for success long-term in terms of your immune system. So again, hope this was helpful. Have a great day. Take care.